Hey folks, welcome back to the show. Today we had a really fun guest who I think is going to bring something a bit different to what we're used to seeing. He's a philosopher who has really recently written an article with Peter Singer of Peter Singer fame on the ethics surrounding challenge trials. And I thought that this was very interesting because a little bit later this year, we're going to be going into some of the more philosophical underpinnings of science. And so I thought that this would be a nice sort of a taster discussion about how not all the problems in science can be resolved only or solely through scientific methods themselves, that there are certain philosophical underpinnings to these issues. And some of them need to be sort of unraveled using methods that don't solely depend on measurement, modeling, calibration, etc. But I think I've talked too much already, so we'll just go on to our guest. His name is Richard Yetter Chappell, and he wrote a really great article that I think is really interesting on challenge trials and whether that they are sort of ethically permissible for the current COVID-19 climate. So, Richard, just to start off, maybe you could just introduce yourself and your research.
Sure. So thanks very much for having me here today. So I'm an assistant professor of philosophy at the University of Miami. Most of my research is in ethical theory, so I'm mostly thinking about broader ethical principles in more sort of abstract terms, but I'm also interested in their application, especially in cases where they can apply in ways that are kind of maybe surprising or counterintuitive or controversial. And I think our topic for today is sort of a nice example, a nice instance of that.
We love
Um,
controversy. We statisticians do.
Great. Yeah,
Right.
so that's basically what I've been working on recently.
Yeah, definitely. And so, pretty much everyone's aware of COVID-19 at this point. But just out of curiosity, and I'll pop up a picture of the article so everyone can see it and they can reference it. Definitely worth a read. But what sparked your writing of this article? Is it just an application of your own interests, or obviously it's quite topical and a bit under debate right now?
Yeah, no, I mean it was definitely sort of sparked by sort of seeing broader issues going on in the web. I mean, and the big thing for me was actually just sort of feeling a lot of frustration at how I saw the general public debate unfolding, and particularly like amongst my other academics, philosophers on Facebook. It seemed to me that there was a real disconnect between, on the one hand, there being an attitude of being sort of very gung-ho about thinking that we need to radically rethink our sort of social ethics, and in the terms of social distancing and all of these things which impose very significant costs on large numbers of people in ways that are very different from what people were used to before. So people are on board with quite sort of radical changes there, but then sort of combining that with a seeming sort of more conservative attitude towards the ethics of sort of biomedical research and so forth, and people being quite sort of hesitant about the permissibility of doing things that might involve deliberately infecting people with the disease, even in ways that could prove socially beneficial. And so it was particularly that disconnect that seemed to me kind of unprincipled that I wanted to push back on. So I emailed Peter Singer about it and sort of shared some ideas and saw that we were on a similar page in what we thought about it. And so we worked towards first making an op-ed that we got published in the Washington Post, and then expanding it into the academic article.
Cool. Well, I think a lot of people, of course, be a bit flabbergasted that you would possibly accuse clinical science of being at all conservative or slow moving in any way.
Yes, I mean, I'm not sure. It's probably not the scientists' fault. It might be the ethicists that are holding them back. But there does seem to be. I mean, I think it's sort of, in some ways, somewhat surprising that there hasn't been more sort of pressure to have challenge trials already occurring. We'll talk about the reasons for them soon, but it does seem like there's a really strong case to be made, and yet there seems to be not a lot of progress being made to actually make it happen. That's sort of my worry.
Yeah, definitely. Actually, the main thing I latched on to there was that we now have a new excuse for my own work being slow. It's that ethicists are slowing me down. Um, but yeah, cool. So, just for those who are unfamiliar, maybe we should just start off with what is a challenge trial? Because a lot of people, I guess, aren't even really familiar that this is um, a method that's in our sort of clinical scientific toolkit.
Yeah, absolutely. So the essence of a challenge trial is that it involves deliberately exposing human participants to a virus. which sounds like a strange thing to do. Why would you want to do that? But the basic case for it, especially as it applies to vaccine testing, is that it allows you to vastly increase the sort of speed and efficacy of getting the results of testing whether the vaccine works, compared to a standard trial, field trial, where you just sort of give half the participants the vaccine, the others not, and then wait and see how many people from each group end up getting infected over the next 6 months or more. It can be a lot faster if you just, after giving them the vaccine, the one group and the control not, then deliberately, directly infect them with the virus and see the results then. You don't need to wait so long. So it allows for much faster results.
Yeah, and I think that's first of all a very important clarification when we're talking about exposing human subjects to the virus. I think a lot of people have this a bit of an inoculation view, like that, like 18th century inoculation type view of these things, where, well, aren't we already being exposed to the virus? And it's like, well, mechanistically, no, not really on that level. And the idea is that you're essentially giving something akin to some moderated dose of the real deal,
Exactly.
and seeing if the immune response that was supposed to be elicited by the original vaccine is now sufficient to protect them from the real
Developing
game. Yeah,
symptoms.
great, cool. And so I'm sure most people have probably intuited a bit what your position is, but maybe you could just sort of flesh it out or give the main points. What was the position that you and Peter Singer were taking?
Yeah, so the essence of our position is this principle of risk parity, where the idea is that if it's permissible to expose certain members of society to certain risks in the course of their pandemic, that might include, health workers who are under a significant amount of risk, and also sort of non-medical risks of harms that are that people are subject to as a result of, losing their jobs, not being able to go out to work because of needing to abide by social distancing protocols. So all of those kind of risks that we impose in order to help fight the pandemic, if those are permissible in one sort of context or situation, the basic thought of the principle is that a similar or comparable level of risk should be permissible to also apply within the context of a medical trial that could similarly be useful for helping to fight the pandemic. And so the application of it is then that even though there is some risk involved to participants in a challenge trial, they're exposed to this potentially lethal virus, some participants in the trial could end up getting very ill. Depending on how it's done, hopefully not too many, but there is that genuine risk there. But the argument is it's comparable to the risks that other people in society are facing, and it could be even more valuable to help fight the pandemic. So the argument is there's not a deep principled ethical objection to allowing people to voluntarily choose to undergo those risks.
Yeah, and I think especially one of the interesting points of this is that by virtue of being a pandemic, and there's no way that you can truly shut yourself off from it, except me. I've actually succeeded at pretty much shutting myself off from the entire world. But actually, that's how I lived anyway. But yeah, it's the idea that among many issues that there's an inherent risk already being a potential trial participant is already being exposed to these risks, and as nature sort of takes its course, and that by allowing them to participate in a clinical trial, not only are you expediting some of the benefits in the scientific discovery process, but they aren't actually undertaking any greater risk, because this would have eventually come knocking on their door anyway. And I guess the further bit is that by virtue of being under a clinical trial, they have the benefit of supervision, further clinical intervention if things become too aggressive. So I guess you can sort of consider it as a sort of a right tail censoring of the most strong adverse events, where they would be, by virtue of being under monitoring, you could be sort of censoring those most extreme adverse events.
Yeah, absolutely. So there is that nice argument for why it could be beneficial for some of the participants, that if they would have ended up getting sick anyway, at least in this context, they're in a very controlled setting where they can get the best of medical care identified early on with aggressive intervention that could help to avoid, as you suggest, the worst outcomes. It's tricky to make the case that everyone in the trial could expect to have overall better results, because obviously, some members would have, they could have expected to avoid the virus altogether through, careful social distancing and so forth. So I think there is plausibly an overall increase in ex-ante risk. But maybe that's compensated for by, as you suggest, the lowering the sort of the tail end worst outcomes.
Yeah, and you just use
well
an
as, of course,
awesome term. I was an ex-ante risk. Could you describe that to us?
Yes, sorry. So ex-ante risk is just meaning sort of the risk that you face as evaluated before it happens. So given what you know at the time, your ex-ante risk might be low, even if something ends up happening that's detrimental and that's bad. So as far as sort of making assessments based on, given that we have only partial information at any given time, the only thing that we're really in a position to do is to evaluate the ex-ante risk, the risk given that earlier information, and see, is the overall risk that the person faces, is it greater or lesser or moderately comparable in these sort of ex-ante terms?
Great. Well, I'm going to start using that word as if you never taught it to me and I just picked up in, my usual reading. But yeah, great. And so now we've talked a bit the arguments. What are sort of the alternative positions? Is it simply a negation of sort of the points and it's just an alternative is do not? Or are there divergence on different points in this? Do you and Peter Singer sort of differ on where some sort of decision boundaries might be? What are the counter arguments?
Yeah, interesting. So I know in my discussions with Peter about the issue, I haven't really come across any points where we're in really any stark disagreement, at least on this practical issue here. So I think we're looking at it pretty similarly. But there's definitely room for people to be on board with sort of challenge trials in general, like maybe for less risky, for less harmful kinds of viruses, but to be concerned about one that's potentially lethal as the coronavirus is and think maybe that's just too risky. And I guess their argument would be that that researchers maybe have a special duty of care to their research participants to not expose them to significant risk, and that maybe according to those ethicists would outweigh our more general obligation to society and to reducing the total toll of the pandemic. I think that ethical perspective is misguided. I think we should be more concerned about, I think we should be concerned about everyone and not just a little sort of handful of people, and just particularly if they're volunteering to help. I think that we should sort of embrace that help where we can get it.
Yeah, that's yet again another interesting part that there's sort of I guess a little bit of a balancing act because I was thinking that much of the objection to a challenge trial would be that if the virus is of insufficiently high risk, that it wouldn't be worthwhile because you want to go through your nice clinical steps. Whereas, obviously on the other end, it's if the risk of exposure to the virus is sufficiently high, obviously you don't want to be, nuking people or anything. And that, so it's sort of that balancing act where people, I guess, would be more comfortable with a challenge trial within certain risk parameters, neither too high or neither too low.
Yeah, that sounds right. As far as sort of trying to pin down the kind of common sense response here, it does seem like you've sort of nicely pinned down the risks on either side there in terms of what people might object to.
Just as a quick aside, as a philosopher, are the common sense responses? I mean, presumably that's much of what you have to contend with when dealing with the public. That it's a series of common sense objections and responses, and that you want to make sure that your argument sort of lands in that common sense zone.
Yeah, I mean, this to some extent. I mean, you don't want people to just dismiss what you're saying as seeming like outlandish, crazy philosopher talk. So you want to be able to engage with the common sense concerns and explain why you're able to address them as well as you can. On the other hand, I wouldn't want to be just entirely beholden to common sense intuitions. I think part of the role of sort of philosophers and ethical theorists is to try to appeal to broader principles which can show why some of our initial intuitions and responses might actually be kind of biased or misguided. And so if we can say things that can lead people to actually change their minds or to reconsider their initial assumptions, I think that can be valuable too.
Yeah, so I guess it's helping people move beyond the idea of, I guess, the common sense consideration is one that's intuitively gratifying in some way, and that you do need to make movement beyond this intuition in order to make real discoveries that our little primate brains might not come to originally.
Exactly, yeah. So moving beyond just the gut reactions to seeing what is more systematically justifiable.
Cool. And I guess that's something that you have in common with statisticians, and that we try to peel back at least a few layers so that we aren't reliant on just intuition alone.
Yeah, absolutely.
Yeah. So one of the issues is that that I was interested in is that there's this sort of utilitarian benefit to the argument. That the just again, to use that common sense thing, that the benefits outweigh the costs of this. But you've also brought into this idea of patient consent, that the idea that is if a patient is, one, informed of the risks, and two, cognizant of the potential benefits, that the research is then on stronger ethical footing. And I was just curious, is a patient consenting to the informed risk sufficient from your position to make this ethically acceptable?
Yeah, so I mean, I think that's a tricky one. So, I mean, I do
It's
think
a
that it's
trap.
maybe the most important or like the most salient ethical factor that's going to go a long way to preventing unethical research. So we talk a bit in our paper about how the sort of many of the sort of traditional examples of unethical research in the 20th century involve gross violations of informed consent. And so informed consent would suffice to avoid those really bad outcomes. Um, I would hesitate to say that it's completely sufficient just on its own. I mean, I don't sort of want to take a stand either way. Maybe it could be, but there are definitely cases where people would raise concerns. So, you could have someone who's in a very high risk group, for example, where you might think, well, wouldn't it make more sense to choose participants who are in a lower risk group? There can be worries about whether people might be in some sense sort of under some kind of internal compulsion to help. So I know that people have raised objections, for example, to if someone has had a relative die of an illness, maybe you shouldn't be accepting that patient as that person to then be a participant. I'm actually not committed to wanting to rule that out. I think that's maybe a bit paternalistic, and if someone wants to honor the memory of a loved one by trying to fight the virus that killed them, then I personally would think that maybe we should allow that. But you'd want to make sure that they understood the risks that they were undertaking, that it truly was informed consent, and that they weren't just rushing into it without really considering the risks.
Yeah, I guess, and you've just led to a very good point, which is the idea of understanding the risks. And, human beings generally sort of struggle to understand issues like probability and risk and things like that, which is why they employ data scientists and statisticians to waggle their finger at them on these issues. And actually, I think it might have been Laplace who said something to the extent of, maybe someone can pop this up in the comment section, but it is the idea where like a human being's capacity for rationality seems to dissipate the moment probability and risk and uncertainty is brought into the equation. And so I guess one of the questions is, to what extent are people able to, human beings are like almost categorically struggle to understand the issues of risk. And it doesn't matter if you have a PhD in mathematics or statistics or anything else, like, or if you're a 5-year-old kid, we really struggle to understand risk as a concept and act in a rational fashion due to it. But is there one of the ethical challenges in this is, of course, you have to overcome this comprehension of risk and make sure that you've sufficiently informed a person. Obviously, awareness of the risk and awareness of people's inability to understand risk is not sufficient to help them overcome their ability to understand risk. I guess it's like the G.I. Joe fallacy, where like knowing is half the battle. But which it isn't. Knowing that humans aren't good at understanding these concepts is not the same as having overcome a human's ability to understand the concept. So I guess I'm a little curious what are your thoughts on the issue that it's hard to help someone understand risk?
Yeah, no, it is an incredibly tricky issue. And I don't really have the expertise to know how to address the practicalities of that so well. I imagine that you and your readers probably have more, you and your listeners have more of an idea of how to deal with that. I guess things like explaining the risk in terms of frequencies rather than just percentages and stuff like that can kind of help people to understand it somewhat. I'm sure medical researchers who do these experiments know a lot more about how best to communicate it. I guess from an ethical perspective, aside from the practicalities of how best to do that, I think there's an interesting question about how concerned should we be about our inability to really assure ourselves with certainty that the participants are fully informed and truly understand the risks. To what extent does the ethics of informed consent depend on like perfect understanding, or what degree of understanding is sufficient to make it ethical? So I think that's a very difficult question. I think in a sense, the most important thing is going to be to make sure that the participants all at least have a general understanding of what's going to happen to them. They understand that they're going to be exposed to this virus. They know, anyone who's been watching the news knows that there's a significant amount of risk to the virus, and that needs to be communicated to them as well, that they are being exposed to this, and so they will be facing that risk. Whether they are able to understand, like, quantitatively exactly what the risk amounts to, I don't know to what extent that kind of detailed knowledge is going to be essential. I think the most important thing would be to ensure that the participants all understand that there is sort of significant risk there. If they're not comfortable with it, they shouldn't participate in the trial. If they don't feel like they have a good understanding of the risk, they might want to bow out of the trial. But if they're willing to go ahead, given their understanding of the risk, however, incomplete or inadequate that might be, including uncertainties about whether they might be in some kind of high-risk group without realizing it and all these sorts of things. There's just a lot of uncertainties. If they're okay with that uncertainty and they're willing to go ahead regardless, then ultimately that's sort of the responsibility is then on that individual to have made that decision for themselves. And I think as long as the researchers have sort of done a good faith attempt to communicate as well as they can their understanding of the risk to the participants, that's really the best we can hope for. And I wouldn't want to like be ruling out, like disallowing research just on the basis of like we can't communicate it perfectly. I think we just need to do it in good faith, and then people are responsible for making their own decisions after that point.
Yeah, and I guess also the issue of perfect communication would also be a little bit reliant on the idea that you've actually perfectly calculated what the risk would be anyway. And since that is frankly like scientifically laughable, that for any given person you've actually found the risk, which is basically the purpose of the research anyway, to actually understand what these differentials in risk are. Obviously for a clinical trial, the idea would be there's a risk differential between the person who has had the vaccination and the person who has not. But there's also further elements of, the differentials in the effect size of affliction of the disease, for example, which risk group that they're in, whether or not you're going to be an asymptomatic carrier versus a someone who, suffers a fatal heart attack or fatal respiratory failure due to that. Yeah, but yeah, that's cool. And I guess just to round out the issue is, when we get back to the common sense perspective of cost versus benefits of this, would there be any reason to believe that it's necessary for the patient to understand the benefits as well?
I don't really see why that would be ethically necessary. It certainly seems like it would be sort of useful to make sure the participants know why it could be worthwhile for them to engage in the study. For one thing, that might encourage more of them to agree to go along with it.
Yeah, great recruitment technique.
So yeah, it's definitely worth doing. But if someone either declines to participate because they didn't fully grasp the possible benefits, or they do participate even though it's even better than they realized, I think either of those outcomes is sort of morally okay. It's just the better they understand it, including the possible benefits, the better. Yeah. It's a bonus.
Yeah, I guess the only one that would be truly objectionable is if the benefits were vastly overstated such that the patient then couldn't weigh their own personal risk against it. So,
yes.
Yeah.
Yeah, so if they came in with beliefs about the benefits that were inaccurate, they would definitely need to be corrected. Yeah.
Yeah, definitely. So it's like the vaccine will not only protect you for COVID-19, it'll also make you taller, better looking, things like that. Obviously, we can't be doing that. But if it's relegated to the medical benefits, great, cool. And so I guess another issue that is of interest is presumably a study that has, a high chance of inconclusive results would also be considered either unethical or bordering on ethical or sort of ethically suspect, because if there's no scientific benefit to weigh against the risk of the individual, I guess we've sort of been hitting on this on an individual level, but I guess now the question is from a full study perspective, that we would have, if we had a study that has a high chance of inconclusivity, we consider it unethical. But right now, one of the most promising vaccines coming out is the one from the Oxford, the Jenner Institute at Oxford. And they've publicly discussed the potential shortage of exposed patients and how that could affect the conclusiveness of the study. So obviously that's a statement, but it's a fairly open-ended one. Do you have any comments on that issue, that obviously this could help address that?
Yeah, so I mean, it definitely seems like a good candidate for moving to challenge trials if they're having difficulty thinking that in an ordinary field trial, there would be enough people ending up getting exposed to the virus in order to get the results they need. So there's sort of a pragmatic case there. In terms of whether the high chance of inconclusive results would make the trial as a whole unethical, like that it would be better to have not even done the trial at all, I'd be hesitant to go that far, because it might be that given how incredibly valuable it would be to get conclusive results, even if there's only a small chance of getting that immense benefit of like, finally being able to solve the pandemic, even a small chance of that is worth it, I think.
Yeah.
So it's going to depend on the risks. If it's an extremely high chance, like you've got no chance at all of getting any results, then yeah, then there'd be no point.
Yeah. So I guess one of the issues is, from sort of a statistical perspective, is that if you could have a chance at a very high effect size, such that it would mitigate the risk due to a lower population or a lower study population, then that could sort of help you along the way.
Exactly. So, yeah. So decision theorists talk about this concept of expected value, where you basically are multiplying through the potential magnitude of the benefit in proportion to the probability that it'll occur. And so, like a certainty of a moderate benefit has basically the same expected value as like a 1 in 10th chance of 10 times the benefit. It just sort of multiplies out.
Cool. Well, I know that in medical domains, we're heavily oriented towards, the removal of type 1 statistical errors, the removal of false positive conclusions. And they're obviously undesirable from a treatment perspective because due to many of the issues surrounding the administration of a treatment that doesn't work, that you don't want to administer a treatment that doesn't work for the patient. And there's something of this, visceral element that you could think about that, from the perspective that the treatment provider is financially gaining from the ineffective treatment. So I think that's sort of, it's an additional element to this that particularly is a little bit of a burr in our side.
Mm.
But there's also type 2 errors, which are the false negative conclusions, are more broadly, you could call it the failure to identify a viable treatment. And so in a lot of medical fields and medical statisticians, we tend to be very, very focused. We acknowledge both, because it's impossible not to acknowledge them. It's a nice little table. We can see where each little conclusion falls. But still, there's a very heavy focus on avoiding type 1 errors. Type 2 errors, well, I'll leave the assessment of type 2 errors to other people. But the idea is that it's not quite as visceral for a variety of reasons beyond just basic probability issues. But I'm curious, do ethicists tend to concern themselves with, a type 1 error versus a type 2 error, for example? Are there inherent differences in these different types of errors?
Yeah, I mean, I think there are definitely some theorists who would accept principles that would lead to a sort of differentiation here. I don't, and I'll explain why not in a moment. But that the sort of theorists I have in mind are people who accept a strong kind of doing-allowing distinction, who think that it's much worse to do something that causes a harm to someone than it is to fail to benefit them. And so if you have this asymmetry between harming and failing to benefit, you can kind of see how this would carry over to this medical context of saying, well, applying a treatment to someone that doesn't work and that leads them to, maybe act more recklessly and end up getting ill when they otherwise wouldn't have, you've caused a harm to them in effect, compared to merely failing to identify a successful treatment or vaccine, and as a result, not failing to benefit people. It sort of is judged as not as morally serious an issue. So people do sort of draw on that, and I think sort of there are some sort of common sense grounds for this, that a lot of people psychologically will think that there does seem to be a difference between the two cases. My inclination is very much more to think that what matters is just the magnitudes of the harms and benefits to people at the end of the day. And if you're missing out on a possible cure, that can be a very serious matter indeed. And there are a lot of ongoing harms that are happening that could be prevented if we could, find a cure, find a vaccine. And so I think we should be very worried about the type 2 errors as well as the type 1 ones. And so I wouldn't want, I sort of see it as something of a prejudice to think that doing is so much more serious than allowing, or that harming is so much worse than failing to benefit. I really think we should do what's best overall.
Cool. And for those who are using a bit more of a, I guess, a layman's term of utilitarianism, is that well aligned with the idea of utilitarianism, where you're more or less nebulous between harms and benefits that are proactively taken versus harms and benefits that are not, that are the result of inaction?
Yes, exactly. So the sort of utilitarian moral perspective is the kind of one that I'm channeling here and saying that, yeah, what matters at the end of the day is just the actual outcomes, the magnitudes of the harms and benefits, but harms and benefits themselves are kind of morally symmetrical in their significance. You should be just as concerned about the loss of a benefit as you would be about the imposition of a harm. And so, yeah, they all sort of count equally from this moral perspective.
Cool. And I guess would the utilitarian account for the fact of the great benefit to someone, selling an ineffective treatment? I guess that benefit never gets really taken into effect, does it? That you might have your own private island for selling an ineffective treatment. So regardless of the harm you did, you got to factor in that one little person too.
Yeah, I mean, it would probably be a pretty small, if it's just
Very
one
small.
person compared to the amount of harm they're doing, but I guess it would count for something.
Yeah, you got to make sure that those weights are balanced. Great. Well, Richard, I really appreciate you taking the time to talk to us today, and also just being so fast about your replies and getting this recorded. But what would you suggest if people were more interested? We're going to pop up the article. It's going to be I'll show a picture of it right now, and it's also a link is going to be in the comment section in the video description. But if people are interested in learning a little bit more about the subjects, what would you suggest is a practical first reading? Would it be practical ethics, or what would it be?
Yeah, I mean, so Peter Singer's Practical Ethics is a great sort of introduction to people interested in applying sort of ethical principles and thinking about ethics in a really systematic way. For anyone interested in following up on this particular issue in a bit more detail, I'd recommend just checking out the One Day Sooner website, where they actually have a research section as well, where they have a research paper where they've sort of looked at the sort of the pros and cons of challenge trials in a bit more detail. And I think that's a very interesting read as well.
Yeah, actually, I'm a little bit embarrassed that I forgot to mention One Day Sooner throughout this. So yeah, I'll pop up a quick picture of that website right now and conclude that as a referenced website where people are proactively, for those who aren't familiar with, people are proactively signing up as volunteers for something, either a challenge trial or simply a non-challenge vaccination trial anyway. And I guess that there are also elements of this where when people are looking at multiple potential vaccines, that if you need a patient population that can cover the gamut of potential the potential treatments, that people are signing up so that a multitude of trials can be well populated and tested. So great. Richard, thanks so much for your time today. I really appreciate it.
Well, thanks very much for the chat. It was great fun.
Great.
Okay, see you later.
Hey folks, it's Glenn. I hope you enjoyed this episode of Pod of Asclepius. If so, please consider leaving a like, a comment, and hitting that subscribe and bell button. For a small channel and every bit helps. If you have a department, a lab, or even just friends who would like this episode, definitely forward it along. I don't have any of those things, but if you do, you should definitely celebrate by sending them an episode. We've got plenty of episodes on healthcare topics, particularly in data science and machine learning, so check out the other episodes on the channel, or some of the playlists. You can also check out our website to join our mailing list or see our sponsors. Thanks so much to our sponsors for their support. And while the views discussed on the show are undoubtedly scintillating, they don't necessarily represent the views of our sponsors, the speaker's employer, my views, your views, my neighbor's cat's views, your cat's views, or anyone else not saying the words. In fact, they might not even represent the speaker's views by the time you're hearing it, so be sure to subscribe in case they come back onto the show to change their mind. See what I did there? Thanks again.